This program is brought to you in part through a grant from Cancer Treatment Centers of America, winning the fight against cancer every day. The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. This week, the American Health Journal presents a special report, Discoveries in Alternative Medicine, with your host, Roger Cooper.
Hello and welcome to the American Health Journal special report on Discoveries in Alternative Medicine. I'm Roger Cooper. Our program today focuses on naturopathic physicians, doctors who are trained in the art and science of natural medicine. Although it almost disappeared in the mid-20th century because of the popularity of drugs and surgery, naturopathic medicine is making a comeback as a natural, vital part of the healthcare system. First up, living with cancer, we'll meet a woman who tells us how the events of September 11, 2001 helped her decide to live. Then, a look at how natural medicine and conventional medicine are working side by side in the treatment of cancer. Next, maintaining a quality of life with cancer, the natural way. Later, living with cancer is one thing, but can cancer be prevented? Also, our environment, how our distance or insulation from nature is harming us, and how certain environmental tools can help us return to health. We begin today with living with cancer. Meet Diane Paradise, a woman whose doctor told her she had just 12 weeks to live.
I went to the doctors, it was misdiagnosed twice, and I finally decided to have surgery. And when I did, it came back that it was Hodgkin's disease, lymphocyte predominant, and I went through 6 months of chemotherapy. I followed it with 6 weeks of radiation. The thing I remember the most about it is the insomnia because of the pain. And I remember at night, and this is the most vivid memory I have, is that at night I would have to sit on the floor and wrap my knees around my chest and hold them there and just rock until I passed out from exhaustion. Radiation just fatigued me, and at the end of the radiation I ended up with a 3rd-degree burn. I really thought to myself, I never want to go through this again. And they figured 5 years I would be cured. 5 years, I had my little I'm cancer-free, I'm cured party with friends and family. At my 6-year checkup was when I found out that it was not only back, but it was back with a vengeance. It was stage 3, and it was pretty much in most of my lymph nodes in my body. And the doctor referred me to another doctor, and when I went to that doctor, he had 10 months of chemotherapy and a bone marrow transplant, all planned out. And I thought, I don't want to go through this again. I'm young. I'll adjust. I want a quality life. It really didn't matter to me if I had quantity. It really mattered if I had quality, and I did not want to be sick. I ended up sitting my family down and telling them I wasn't going to receive any treatment. And then I went on vacation. I left and went to Hilton Head Island, had a blast with my friends, and while I was on vacation, September 11th happened. And I remember very clearly because as I was watching that, I started to think there were so many people that day that passed away, that died, and they didn't have a choice. And I had a choice, and I was choosing to die. And it was then that I realized that I had to look for a natural alternative. There had to be something to help me get my lymphatic system, my immune system working again. And I found Dr. Rubin. The first 25 minutes were nothing about me. It was about my family, my friends, my support system, the death of my parents. How did I handle that? And I sat there after about 25 minutes of constant questions like this thinking, did I make a mistake? Aren't we here to talk about cancer? And when I did that, it was at that moment he looked at me and said, who's the woodworker in your family? And I said, my father was a woodworker. Did he use treated lumber? Yes. Were you anywhere near the treated lumber? Yes, I used to clean up the sawdust. And at that moment he handed me a thing of paper that was about an inch thick, maybe a half-inch thick, that said copper was in treated lumber. And copper was directly correlated to the type of Hodgkin's disease that I had. At that moment, I realized he just did more for me and taught me more about the root cause of my disease than anybody ever had. He had already started putting together the pieces of the puzzle. I went home to my doctor and I said to him that this is what I'm going to do, and he said that he would be dead in 12 weeks. And I got on a plane anyways and took my chances. And we went through, I think it was 5 days of treatment with Dr. Rubin. I woke up the following Monday morning at 6 o'clock in the morning. I had so much energy. I hadn't had that much energy in months. I walked into the clinic and Dr. Rubin's assistant looked at me and said, "Can I help you?" She didn't recognize me.
Now, 14 years later, Diane is empowering people with cancer to be their own cancer superhero through speaking, coaching, support tools, and her blog at www.naturalcancergirl.com.
Diane Paradise has a spirit that's unwavering. I often said that great deeds in medicine stem from raw physician talent and the unwavering courage of our patients. And the relationship that I have with Diane Paradise is one of that. This is an instance where I can be proud, again, to have the opportunity to help somebody live and live well, who then goes on to help others. You don't see that very often. This is a true pay-it-forward story.
You're watching the American Health Journal presents Discoveries in Alternative Medicine.
For a look now at how NDs and MDs are integrating cancer treatment, here's our reporter, Laura Windsor.
To find out how naturopathic doctors are working more closely with conventional medical doctors in the treatment of cancer, we asked San Francisco medical doctor Bill Benda his views on the naturopathic field.
There was a time when conventional physicians and naturopathic physicians didn't even talk to each other. And starting in the 1970s, a third entity began to become apparent in our culture, and that was the holistic MD. At first, these conventionally trained physicians who knew there was a different way to practice medicine, a more natural way, a less invasive way, were ridiculed and shunned by both their own profession and by the alternative professions. But starting in the 1990s, with the rise of people like Deepak Chopra, Dean Ornish, Andy Weil, and the rest, and the backing of public acceptance, the holistic medical doctor has found their place in today's healthcare system. And they do actually bridge well that no man's land in between conventional and alternative medicine. If there was a conventional medicine counterpart to the naturopathic physician, I think the holistic MD would be the one. Now, we, as holistic MDs, do not have the same depth and breadth of training in those botanical, Chinese medicine, nutritional therapies that the naturopathic physicians do, nor do they have the same depth and breadth of training in the areas that we are competent in. But we're each learning more and more about each other, and there's really no way any one individual can go to conventional medical school and go to traditional Chinese medical school and go to naturopathic medical school and actually retain and learn all that and then go off and start their own clinic. So the alternative to that is to have a clinic that has a conventional holistic physician, a naturopathic physician, a traditional Chinese medicine practitioner, a homeopathic physician, and whatever other professions we choose to put in there. So the clinic itself, just like the therapies, becomes integrated.
We also went to Cancer Treatment Centers of America in Phoenix, Arizona, and asked Dr. Tim Birdsall how naturopathic medicine can be combined with conventional therapies to the benefit of the patient.
Naturopathic medicine, in conjunction with conventional chemotherapy or conventional therapies of any type, can really help to reduce very specific kinds of symptoms. So, for example, reducing nausea or vomiting, Some chemotherapy agents, for example, have very distinctive side effects that they cause. Peripheral neuropathy, which is numbness, tingling, pain in the hands and feet. And that can actually be very debilitating. It can keep you from being able to button the buttons on your shirt or tie your shoes. And if we can reduce that or eliminate that, then patients' quality of life is much, much better. And at the same time, we don't have to decrease the dose of their treatment or stop the treatment altogether. Oftentimes, when patients are undergoing treatment for their cancer, other kinds of health issues kind of fall by the wayside. Cancer patients have every disease that anyone else in society has. They have high blood pressure, they have high cholesterol, they have anxiety, they've got migraine headaches or allergies. And oftentimes, in the press of treating their cancer, which is a life-threatening disease, these other things may get ignored. So part of our role as naturopathic physicians in this kind of a setting is to actually make sure that we're dealing with every issue that the patient has and dealing with the whole